Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome Elham Raker. She's a pediatrician. Today's KevinMD article is Doctors Must Rethink Do No Harm to Help Children with Long COVID. Elham, welcome to the show.
Thank you. Thank you for having me.
All right. Let's start by briefly sharing your story and journey.
So, my story, I'm a pediatrician, as you said. I have been practicing, whatever that means, for 20 plus years. I've done all of it. My husband is in medicine also, so that means I have to move around a bit with his training and jobs and whatnot. So I've done some hospital medicine, outpatient, urgent care. I've done home visits. During the pandemic, I actually pivoted and started doing certification for parent coaching. So I've done that. And then recently I did an integrative medicine scholarship program. So it's been long. I think I've always kind of been thinking, what do I want to be when I grow up?
Mhm.
I'm still, I think, trying to discover that and picking up things along the way. So for now, I'm somewhat enjoying being home with the kids because of circumstances that, this article that we're going to talk about and the coaching part.
All right. So let's talk about this article. Doctors Must
Yeah.
Rethink Do No Harm to Help Children with Long COVID. Tell us about this article for those who didn't get a chance to read it.
Yeah. So, my journey with long COVID in kids started, unfortunately, personally, 3 years ago with my daughter getting it. And of course, like everyone, we didn't really know what it was at first. She came home from school, from a tournament with just these awful, awful headaches, and they just never went away. So one thing led to another with different systems getting involved. And by June 2022, about 6 months after our presentation, we were pretty sure that she had long COVID. And there was nothing that any doctor offered.
Hmm.
Even when I mentioned it, even when we kind of said, okay, is this long COVID? Could this be long COVID? It was kind of like, yeah, but whatever. And when we got to a long COVID clinic, someone that I would count on for expertise, it was very validating, which is great, right? I know a lot of these patients have been gaslit and told you're fine, nothing's wrong. So the validation was there, but again, there was not even treatment offers, but just, hey, kids with long COVID are also getting this. And there's a slew of things that are happening that you know, I really discovered on my own from other patients from Facebook groups. And that was just a little disappointing. So the main thing is that we don't know a lot of things, and I appreciate that. It's new. There needs to be more research, which is one of my main points in my article. There's only one research study for kids in the whole country right now. So that needs to happen, but we can't wait for those things because these kids are really suffering.
Hmm.
They're Many of them are just in bed all day. They can't go to school, they can't do life, they can't see their friends, they can't do sports. It's significant changes to what they've been doing, and these are developmental years we're talking. I mean, these are really important years. So um, I think one misnomer is that kids aren't getting long COVID, or they're not getting it as bad, or they're not getting it as much. Most of the data, I think, confirms that long COVID, again, even in adults, it's very hit or miss. I've
Yeah.
seen numbers anywhere from 5 to 70% of people that get COVID get long COVID. So the numbers are all over the place, but it seems to be 10 to 20% is the consensus. And that is the consensus for kids too. So we're talking millions of kids, right? And with each infection, your risk of long COVID increases. So those numbers are only going to go up.
Sure.
So we're dealing with something more significant, I think, than people are aware of. And, you know, saying that kids are just going to get better, they may, but again, they can get reinfected and get worse, which is what happened to my daughter. So you have that to deal with. And even a year or 2 years of laying in bed for a child is just really not acceptable to just say, well, we'll just wait for this to pass.
So you said that there isn't as much research as you would like when it comes to long COVID in kids, and you went to a specific long COVID clinic. Tell us the type of information that you received in this clinic that some of the other doctors who may not be as well versed in long COVID simply didn't know about. What was some of this specialized information that you could share with us?
Yeah. So I'd say the first thing is, unfortunately, that long COVID clinic was not helpful, but we had to go out of country to a outpatient clinic in Denver that was seeing kids. So a lot of these kids, a lot of adults are presenting, especially with the more severe cases, with something called POTS, postural orthostatic tachycardic syndrome, which I think many of us learned maybe like this much about it in med school.
Hmm.
So, and that really stems from just general dysautonomia. So the nervous system is not functioning as it should be for unknown reasons at this point. So that may lead to things like gastroparesis because, right, the nerve
Hmm.
innervation isn't there. In my daughter and a lot of children, so I think in different age groups, it's presenting differently, but headaches seem to be a pretty common presentation. Stomach aches, fatigue is probably one of the top presentations. I mean, there's 200 different symptoms. There could be lung airway disease that is not easily identifiable on exam.
Hmm.
So even as a pediatrician, knowing that my daughter has asthma, I did not pick up on her small airway disease. So that was only caught by doing these, the pulmonary function testing and more advanced testing. So I think those are all things that we need to consider. The unfortunate thing is that unless you're near a long COVID clinic, which there's not many of, we have to piecemeal these different specialists.
Hmm.
And last I heard, in my city, seeing a pulmonologist was taking a year. So we have that to deal with is how do you get these kids into these specialists? And then you need someone to kind of put it all together, right? Because you have all these different specialists, they're not necessarily talking to each other. So now how do you put the picture together? EDS is really common, Ehlers-Danlos syndrome in these subgroups, and MCAS, mast cell activation syndrome. So, and it's all very confusing and they all seem to happen at the same time. So those are kind of the things to be on the lookout for, I would say, when you're thinking about testing. Oftentimes, blood tests are normal. The the orthostatic intolerance should be able to pick up on exam. I mean, tilt table would be ideal, but I know that's very hard to get and to, especially for kids, many places stopped doing it years ago. But there is, the laying down and standing up, the orthostatic tolerance test that you can do in your office. So those are at least some initial things that I would think would be good for all pediatricians to be aware of and to know, who are the people that are maybe treating long COVID to some extent that
Hmm.
I can get these patients to. Because I know there's no, we have these limitations in medicine and I get that. We have these, especially in peds, 10, 15-minute visits are not enough time to go through everything happening. So really know your resources in your community, at least if you are not able to, provide that care.
And just to emphasize what you said, there is no unifying treatment that would treat all long COVID symptoms. Like you said, a lot of this has to be piecemeal through different specialists and treated individually, treated each of these complications individually.
Yeah, yeah, exactly. Which is hard. It's hard to get all of those, it's like puzzle pieces.
Hmm.
And you really need help putting those together.
Now, after going through this long COVID experience with your daughter, how has that changed your own practice as a pediatrician?
Yeah, so, I think it's really led me to just learn more, know more, give more, right? I want to give patients more time, more attention, I don't think we can do these things in these short visits, especially for more complicated chronic illnesses. That's what led me to the integrative medicine scholarship to learn more about different offerings, but also I'd like to stay evidence-based.
Mm-hmm.
I think that's another pitfall is if you can't get what you need from your doctor, you're going to get it from somewhere else, right? I mean, if
Yeah.
you see your kid suffering, you're not going to wait around and just hope things get better. So I think that's another thing that doctors need to be aware of and open to, honestly. I mean, yes, first do no harm. But if it's a potential treatment that can hurt, even if it's something that maybe you haven't heard of, or you're not aware of, be open to it, be open to the possibility that it may help them. So I think it's for me, it's just trying to figure out how to help emotionally, physically, mentally, all of these things when we don't know the answers,
Mm-hmm.
but it doesn't mean we don't try.
And how is your daughter doing now after going to that long COVID clinic in Colorado? How is she doing?
Yeah, so she actually started to improve after that, and we were seeing, she was able to go back to school and start doing her sport, but unfortunately, she got COVID again about a year ago. So that led us down this path again, and she's not quite there back to even her baseline from the second COVID, unfortunately. So it's a constant battle, we stay hopeful. I keep reading and hoping for new studies and new things to come out, but we have physicians that are a little bit more versed in the long COVID world, so that's helpful. I think that's really important to find a partner that's willing to try things for you, because I have to say much of what we have done this past year has definitely been out of the box, not FDA approved. So you need to find doctors that are willing to do those things with whatever research is available, right? There's not a ton, but there's some things to show that they're safe at least.
Sure.
So we've done a lot of that, and she's still fighting. So we're hopeful.
So, what are some examples of these unconventional treatments that you alluded to?
Yeah, so I would say one of the top ones that keeps coming up is low dose naltrexone. Naltrexone's been around forever. The idea being that the low dose is actually anti-inflammatory. It's a little difficult because there's no real start at this dose and
Mm-hmm.
get to this dose, or this is the dose that everyone's different. So you start at a really low dose and you go up until you find kind of the magic dose, somewhere between 0.5 and 4.5 is kind of what's been most studied. Some people need to go higher, some people can't tolerate it, but I do think it's one of the ones that has shown promise. Unfortunately, it has to be compounded.
Mm-hmm.
So that's another expense, right? A lot of these are not FDA approved treatments, so insurance won't cover it. Then MCAS is something that I feel like is pretty prevalent within the long COVID community, whether it's the chicken or the egg, right?
Mm-hmm.
Whether they had it and then it just is more prominent, or whether the long COVID initiated, it's hard to know. But H1 and H2 blockers, so something like Zyrtec and famotidine, can be helpful, especially if you have these unexplained like hives or rashes or something happening. That could be the MCAS. So the histamine blockers are something to try in that case. And a lot of times it could be headaches, stomach aches, those
Mm-hmm.
things can be caused by that too. Treatment for POTS, I think, could be very helpful. So if your main thing is stand up, dizzy, fall down kind of things, that you need to certainly be seen by a cardiologist or someone experienced with that to help direct that, because it really depends on what your blood pressure is, how it changes from sitting to standing, all those other things before you decide which medication could be best. And then there's a slew of supplements, right? The
Mm-hmm.
supplement world always comes into play. In my experience and from my reading, I would say that coenzyme Q10 is one that's been recommended pretty consistently for the mitochondrial support. Other ones that I haven't tried, but I hear about are the NAC, NAD, methyl and blue. Those are all like the mitochondrial support. Omega 3s, I think everyone needs omega 3s.
Mhm.
So, like in my daughter's case, who's allergic, she doesn't eat fish. We definitely wanted to make sure that was on board. So, those are the ones that I think are, oh, and magnesium and vitamin D, especially for like magnesium for sleep or headache support, and vitamin D for immune. Um, I think those are kind of the basics, to be honest, that you meet, and you can imagine the supplement world just keeps going and going and going, and you can have a meal of supplements. So we do try to kind of keep it to things that we really think would be helpful.
How difficult was it for you to find a clinician who would partner with you and be willing to try something that may be unconventional?
I think we're fortunate and we were in the medical world, so we could ask people and get referrals. We were able to find doctors. I don't know how people would do it when they don't have that connection, which is another thing that I'm passionate about is how do we get this information out to more people and how do we get people that maybe aren't, on the internet or aren't able
Mhm.
to read or aren't able to do all that to find the people that can help them. So yeah, I think we along with the research, we really need more clinics, more long COVID clinics, so it does become more accessible. And I do hope that happens in the next year or two.
We're talking to Elham Raker. She's a pediatrician, and today's KevinMD article is Doctors Must Rethink Do No Harm to Help Children with Long COVID. Elham, let's end with some take home messages that you want to leave with the KevinMD audience.
Thank you, Kevin. I think just lessons from these past few years, we haven't been gaslit, quote unquote, but it can be minimizing, and I think that if you have a patient with these vague symptoms coming in and the labs are normal, nothing makes sense, just really listen to them, really, don't dismiss them. Even if you don't think you can help them, having someone that believes you, that believes in you can make a huge difference, and giving these patients hope can make a huge difference.
Elham, thank you so much for sharing your story time and insight, and thanks again for coming on the show.
Thank you, Kevin.